Botox is the everyday used term for what we in the medical world describe as a neuromodulator. In South Africa, the two neuromodulators that we have available is Botox and Dysport. These neuromodulators have been around for a very long time. Initially, we used them for treating severe rigidity and spasm in patients with things like cerebral palsy. And lo and behold, we then realized that it can treat and reduce the formation of wrinkles in and around the face. When we look at aesthetic treatments for the face with neuromodulators, we are thinking about treating forehead lines, the glabellar frown lines, these are the lines that form between the eyes, and the crow's feet lines. When we move away from the aesthetic uses of neurotoxins, we start looking at things like overactive bladder syndrome, where we use it to relax the bladder. It's used by neurologists for spasticity conditions and contracture of muscles. And then the latest new uses is for treating and helping wound healing, as well as, lo and behold, erectile dysfunction. We also use these neuromodulators for pain conditions like migraine, tension-type headaches, and TMJ or bruxism, and this is where we grind our teeth. It has other uses as well, and here we think of excessive sweating or hyperhidrosis. People that sweat excessively on the scalp, under the arms, palms, and feet. This is one of the most researched and probably one of the safest treatments that we can do in aesthetics. It works on the following principle. The neurotoxin deactivates a nerve ending, which means that the muscle doesn't get the message to contract. Once the nerve ending is deactivated, the body starts regenerating a new one. Therefore, nothing that we do with a neurotoxin is permanent, and therefore the treatments don't last very long, approximately 3 to 4 months. The treatment consists of doing a series of injections in targeted areas. These injections are fairly painless and can be done in your lunch hour. What we need to remember with these treatments is that the onset of action is delayed. In other words, it only starts working after a few days and then slowly gets better over time. Usually, the maximum onset of action is about day 10 to day 14. It can last anything between 3 to 4 months, depending on the product that was used, the area that was injected, as well as the dose that was given. As one of the most widely used treatments in aesthetic medicine, as well as in other fields, it really becomes important that we know when we do these treatments that the treatment is safe. The result, however, is dependent on who puts it where. The fact that neurotoxins have been used for many years in many different guises and for many indications proves its safety and efficacy. Yet, there can be side effects using this product. These side effects are luckily temporary and self-limiting and can include drooping of muscles and even the eyelids. This makes it incredibly important for you, the patient, to choose your practitioner well, do your homework, and have a full facial assessment so that you can get the most benefit out of this procedure. I've been doing this for over 22 years, and it's one of my go-to treatments for anyone who wants a fresher, healthier, and just more rested look.